Hello there, I'm Stephen Bunting and I'm a physiotherapist working in the northwest of England. If you're new to the channel and want to know a little bit more about me and why I'm making these videos, then click here or see the link in the description below. Okay, so with that done, let's tackle today's topic, osteoarthritis. Before we get started though, please note that this video is for general information only and assumes that you've already been diagnosed with osteoarthritis by a clinician, or you just may be interested in learning a little bit more about the condition in general. Please see the description below for more information and my disclaimer. Now, I will be making some future videos addressing individual joints with osteoarthritis, but this video is about osteoarthritis in general, and that's a big subject, and as such this is going to be one of my longer videos, but if you can spare the time to watch, then I'm confident that you'll feel better equipped to manage your joints for the future. As with all my videos, I'll be tackling the condition by answering the three most common questions asked by patients. Number 1, what is it? Number 2, why have I got it? And number 3, what can I do about it? What are my options? Okay, so let's crack on with question 1. What is osteoarthritis? Well, the word, like many medical terms, comes from the ancient Greek, with osteo meaning related to bones, arthro meaning related to joints, and itis meaning inflammation. So the whole thing put together means inflammation of the joints between bones. The name osteoarthritis has been used since the late 1800s, and up until fairly recently we thought that the itis part was wrong because researchers couldn't find any evidence of joint inflammation and instead found the main problem was joint degeneration, prompting some people to use the term osteoarthrosis instead, as osis means degeneration. However, the very latest research has shown that the condition is actually driven by a chronic low-grade inflammation, which then leads to degeneration and thinning of the joint cartilage. Cartilage is the slippy, gristly substance that covers the bone ends and helps the joint to move smoothly. You might have come across it when cutting your Sunday roast. So to understand what happens in osteoarthritis, let's first look at the features of a normal, healthy joint. And the key features are smooth bone ends covered by an even layer of cartilage. We then have a capsule to protect and enclose the joint space, within which is contained the synovial fluid, an oily substance to help with joint lubrication. Finally, we have tight ligaments to reinforce the capsule and support the joint, and then strong healthy muscles to provide movement of the joint. In osteoarthritis there are a few key changes. Initially there's thinning and degeneration of the cartilage. This causes the bone ends to come closer together, which narrows the joint space and slackens the ligaments, causing extra joint play. The body's response to this is to extend the edges of the joint, essentially growing extra bone in an attempt to stabilise the joint. We call these osteophytes, and you can see them clearly on X-ray. The joint capsule then thickens and produces extra synovial fluid to compensate for the lack of cartilage, but this extra fluid can interfere with movement and cause joint swelling. We can determine the severity of osteoarthritis by looking at X-rays and working out how narrow the joint space is, and also the size and number of osteophytes and the degree of roughening you can see at the bone ends. Here is a joint with mild osteoarthritis, as the only change is a narrowed joint space. This X-ray shows more advanced changes with numerous osteophytes and roughened bone. So now we know what osteoarthritis is, let's talk about symptoms. First off, which joints are affected? Well, osteoarthritis can affect any joint, but is much more common in the hips, knees, spine and the small joints of the hands and feet, particularly the thumbs and the big toes. And the symptoms of osteoarthritis are joint pain, stiffness and difficulty with joint movement. The pain often occurs with movement, but an aching pain can also occur with prolonged rest as the joint stiffens up. Some people may have joint swelling during a flare-up, or a feeling of grating or crackling during joint movement, which we call crepitus. Pain and stiffness can be worse first thing in the morning when you first start moving, but this should settle down within about 30 minutes once you're up and about. Morning pain and stiffness of the joints lasting more than 60 minutes might be an indication of something different going on, like an inflammatory disease such as rheumatoid arthritis, which is a very different condition. If your symptoms are like this, then you should always get checked out by a healthcare professional, as early diagnosis is important. Okay, so that's osteoarthritis in a nutshell. So let's go on to question 2. Why have I got it? Well, the first thing to say is that osteoarthritis is not a disease. You can't catch it. It's a process of age-related degeneration, and indeed it'll usually affect most of us to some degree if we live to be old enough. It's just that some people might develop it later in life, and other people might develop it much earlier in life when they're still active and working. And whether osteoarthritis affects us earlier in life depends on a number of different risk factors. We certainly know that genetics plays an important role, and so family history is one of the most important risk factors. The other known risk factors are older age, being overweight, previous injury to the joint, or a history of other joint-related conditions such as gout or rheumatoid arthritis. We also know that osteoarthritis more commonly affects women. The other important risk factors relate to lifestyle. We know that normal healthy cartilage depends on regulating the growth of new cartilage cells balanced against the death of old cartilage cells. And the latest research has identified that poor diet and a lack of regular exercise can interfere with this natural balanced state and set into motion a series of chemical events that eventually leads to degeneration and thinning of the joint cartilage. And this is where things can get a bit confusing, because osteoarthritis sometimes gets called a wear and tear condition, which suggests that the more a joint is used, the quicker it will wear out. And we now know that that's just plain wrong. Otherwise, everyone who exercises regularly would have lots of osteoarthritis, and every sedentary person would have none. And that's just not what we see. In fact, we see just the opposite. Having said that, there are circumstances where excessive joint use can cause osteoarthritis, but this tends to be in a minority of cases, involving prolonged strenuous activity, usually seen in heavy manual jobs over many years. It's also not unusual to see osteoarthritis affecting people who've done high-impact sports, such as rugby or football, over many years. But we think this is due to the injuries associated with these sports rather than the sports activities themselves. An example of excessive overuse might be osteoarthritis of the lower back due to years of heavy lifting in poor postures, or knee osteoarthritis due to years of kneeling on hard surfaces. For the vast majority of people, though, it is underuse rather than overuse that contributes to the development of osteoarthritis. Movement and exercise are vital in keeping joints healthy, and unfortunately, modern lifestyles and inactive jobs often just don't use our joints enough. Joints, like many other parts of the body, are use it or lose it structures, and they require regular use in order to keep them healthy. So as you can see, for most people, wear and tear is not a good term to describe osteoarthritis, as it sends the wrong message. As such, we really shouldn't be using it anymore. Okay, so these are the reasons why you might develop osteoarthritic joints. Now let's move on to question 3, and the most important question if you have the condition. What can you do about it? Well, unfortunately, you can't cure osteoarthritis. It is a chronic long-term condition, but there are plenty of things you can do to help with symptoms and to improve your quality of life. The first and most important thing you can do is to address any of the risk factors that might have led you to developing the condition in the first place. Of course, you can't change your genetics or your age, but you can certainly try and lose weight and increase your activity levels, and these are the single most important things that you can do. Even a 2 kilogram weight loss can significantly reduce the amount of stress through the hips and knees and help reduce symptoms. People often tell me that they struggle to lose weight as they can't exercise due to pain. I'm going to address exercise in the next section, but as far as weight loss goes, the vast majority of weight loss occurs through diet, and that's where your focus should be. If you tried and struggled with weight loss in the past, then do get help. It can be a hard battle to fight alone, and those who succeed usually do so by building a strong network of support around them. Your family doctor and local weight loss groups will be able to advise you. As for increasing your activity levels, well, let's start with the basics. Firstly, your job might be a factor. As we've mentioned before, this is usually because of inactivity and associated muscle weakness, poor posture and stiffness. Desk jobs are probably the most common culprit, especially in people who do no regular exercise in their free time. Workplace posture and ergonomics is a topic all by itself, and it's on my list for a future video. But until then, I'll put some links for further information in the description below. On the other hand, you might have a job that involves very strenuous or repetitive activities, and so you might need to think about ways of reducing the strain on your joints. For example, using lifting equipment to help with back strain, or using knee pads or a kneeling cushion to help reduce kneecap pressure. Okay, so on to exercise. And this is the important bit, because if there's one thing I've learned in my 24 years as a physio, it's that no matter how severe your arthritis is on x-ray, how bad your joint pain is, or how much creaking and grinding you feel, some form of regular exercise will nearly always be helpful in reducing symptoms. It's just a case of working within your abilities and following a few simple rules. Firstly, exercise must be done regularly. A 10-minute program of stretches and exercises done 5 times a week would be a bare minimum. 20 to 30 minutes is ideal, and you can break this down into 2 or 3 10-minute sessions throughout the day if that works better for you. Spending 30 minutes on your feet every day can also be really helpful, either walking, using stairs, or just pottering around the house. If you have to use a stick or a walking aid, then that's fine. Exercise should become routine, just like brushing your teeth. It won't work well if it's done occasionally or in bursts of activity followed by periods of rest lasting days or weeks. Joints respond best to regular, predictable amounts of exercise. Secondly, the type of exercise that helps you and the intensity that you do them will depend on your individual abilities. It's difficult to give specific exercise advice in a video aimed at general osteoarthritis, because what you do will often depend on what joints are involved and how bad your symptoms are. But as a rule of thumb, you should be trying to strike a balance between doing too little, where you find them really easy, and doing too much, where you're really struggling to manage them. And this will be very individual for you. You'll only find your level by trying and seeing. Don't be frightened of feeling some pain or aching during and after exercise, but this should settle down fairly quickly, and certainly within an hour. If you get persistent joint swelling after an exercise, then you're definitely doing too much for that joint. Take a step back and start with really gentle movements until your joints get used to the activity. The third rule is to be patient. Exercises are a long-term investment in your joints. You're not going to get instant results. In fact, it's common to feel worse for a few weeks while your joints are adapting to the new regime. So knowing this, always start easily and progress slowly. Think of exercises as being like the rungs of a ladder. You have to allow your joints to get used to the basics before taking the next step up in activity. Taking baby steps in this way and slowly progressing over the weeks and months is the best way. If you push too hard and too fast, then you run the risk of a flare-up, and this will knock your confidence and give you the wrong idea that exercise doesn't work for you. If that happens, then don't give up. Just take a step or two back down our imaginary ladder until things settle for a few weeks, and then you can start stepping it up again, but more slowly this time. It's all a balancing act. It can take a good few weeks before your joints settle into the routine, so try not to give up or lose focus during these early stages when your joints may feel like they are grumbling or you're not making progress. So be patient, but also be persistent and resolute. I will get round to making my own videos to address each individual joint, but until then I'll put a link below to some great websites, in particular Versus Arthritis and the Chartered Society of Physiotherapy have some excellent resources, including good basic exercise programs for the different arthritic joints. The only joints that sometimes don't respond as well to exercises are some of the smaller joints of the hands and feet, particularly the thumbs and big toes. This may be because these joints are generally so active in nearly everyone that they rarely suffer from underuse. In fact, splints to help limit thumb activity or insoles to support the feet are usually a better option in managing osteoarthritis in these smaller joints. I'll address this in more detail in future videos, but otherwise the take-home message for the majority of osteoarthritic joints, and in particular the hips, knees and spine, is that regular low-impact exercise is one of the most important weapons against the symptoms of pain and stiffness. They won't change the appearance of your joints on x-ray, but they can certainly build strength and resilience and help your joints cope better with the daily activities of life. Remember, your joints are use it or lose it structures. Use them regularly and sensibly, and they will respond in kind. The other common treatments used for osteoarthritis are tablets and creams, injections and surgery. To help find out what other treatments might be worth trying, it can be first helpful to try and divide your symptoms into one of two categories. If your joint pain is fairly stable day to day, but has perhaps been slowly worsening over time, then we call this a quiet joint, and a regular painkiller under the advice of a pharmacist or healthcare prescriber can be helpful. Recent studies have also found that using a cream derived from chili peppers called capsaicin cream can help with joint pain when used regularly. In the UK, this is a prescription-only medicine, and so you'll need to see a prescribing clinician. On the other hand, if your joint has become visibly swollen or has significantly worsened beyond its usual background level of pain, then you may be experiencing a flare-up, and this can interfere with your ability to exercise. A flare-up is usually due to a degree of joint inflammation, and so anti-inflammatory tablets or rubbing gels can be helpful in reducing the pain and swelling and settling the flare-up. Again, please see a pharmacist or a healthcare prescriber for advice regarding anti-inflammatories, as not everyone can take them. For a persistent joint flare-up, a cortisone injection can be a very effective treatment. They're usually provided by a specialist clinician and should be used sparingly, as regular use of steroids can be harmful. Another type of injection that shows promise, particularly for mild to moderate osteoarthritis, are the viscosupplementation injections. These are based on a substance called hyaluronic acid, which is found in normal synovial joint fluid. They're thought to improve joint lubrication and have been shown to be a safe and effective treatment for some arthritic joints, particularly mild to moderate knee osteoarthritis. There are also a number of other injections currently undergoing clinical trials, including the use of stem cells and various growth factors, but as yet they haven't shown any significant benefits above standard treatments. But it's early days for these treatments, and it's an active area of research, so let's keep our fingers crossed. And finally, if your joint pain persists and your quality of life is being significantly affected, then you may need to talk to an orthopaedic surgeon about the surgical options, including joint replacement. And that's it. Well done for making it to the end. I know it's a big subject, but I've tried to provide the basic information needed to help you manage the condition yourself wherever possible. And we've also mentioned some of the other treatments that can be considered if you're struggling. If you have any suggestions or comments, then please leave them below, but please be aware that I can't provide any personal advice. I do hope you found the video helpful. Thanks very much for watching, and bye for now.